So, hello, my name is Flo, and I'm a community connector for the Core20plus5 project. I am based in Hardwick and Longsight, and I work alongside PCN, local PCN Neighbourhood, an amazing person called Carlos. He's a health coordinator for the NHS, and we look after researching about bowel cancer. I want to know more the effect, basically, like how many people are uptaking, bowel cancer test, or the kits are being sent, and what type of information the local community have in Hardwick and Longsight in regards to bowel cancer. But also work with a charity called AfroCats. It helps refugee women and asylum seeker women to integrate within the community, and more specifically, it's a maternity project. So we're discussing everything maternal, postnatal care, and just supporting them throughout pregnancy, because some women are pregnant right now and some have children at least under 1 and all the way to 16, but most of them have under 5s, at least 1 under 5, 1 under 1s. So the reason why I became a connector is, first of all, personal to me, because my mom, she was a refugee. She just flee from the Congo, and I saw her struggle. I was a young 13-year-old, and I accompanied her where she went into refugee actions, when she went into the CIB, Citizens Advice Bureau, and GPs, and I saw her struggle. And I saw the aftermath when she was at home and feeling that there was really nobody there to listen to her. And I knew that when I will have the mean, or when I'll have the knowledge, I would just like to better help our community really integrate and be aware of what's available in regards to healthcare and services, and which we're doing right now. So the health disparities that I am working on, it's bowel cancer with the NHS. So they've realized that, African and Asian, so BME minority, we are uptaking less the test to find out basically our status in regards to bowel cancer, just taking the test to know whether or not, everything is okay, and are we uptaking, listening to the sign, and are we consulting practitioners, clinicians in regards to our care, both men and women. So they spoke to the community, and there is like a national statistics, and they realized that we were really low, and that's why cancer was brought into the Core20plus5 project. So I have been engaging with refugee women, and we based in Longsight. So we've been having weekly and quarterly sessions. So every other week we have like a maternity discussions, where we have a midwife, we had show starts, we've had like the health coordinator, someone that came to speak about cancer and how we can, know our signs. We've had dancing so that we can be exercising, because I've heard that, now with COVID and we're not that active, it's really good that women and just people in general are getting outside and, communicating and engaging with each other in order to avoid obviously another health disparity that we're discussing, which is anxiety and mental health, and especially in regards to women with children under 5 or pregnant women and the danger that it can cause if it's gone unnoticed. So we visited Shore Star. So where we had like a sessions where we kind of like give all the women tools in regards to where they can go if they had like, you know, any issues. For example, if they had a child who needed to start school but they didn't know how to go about it, so there is like an outreach worker at the Show Star. So I kind of like make them link together, like, you know, help them with the forms. And also we had like discussion in regards to like healthy eating. So it's like, you know, helping them fill in the form in regards to healthy start vouchers. We've had sessions where women are getting vitamin D's because, you know, our skin seems to like uptake less. It needs more sunlight, so we need like more supplement, and that's why we're encouraging, based on clinical study, that, you know, our community needed more vitamin D within their diet, especially breastfeeding women, which I am supporting, and, you know, pregnant women as well. So that's what we've been doing. We've had really good success because women now knows where they can go to get this vitamin D every month. So they have like a month supply, and every time it finish, they know where to go, and it's free of charge. Prior to that, they were, you know, we had like a discussion where they were really frustrated that they couldn't afford, you know, these vitamins D, and the GP were asking them, you know, to go and buy it from the pharmacy. And unfortunately, due to financial difficulty, especially now with the cost of living, the women were finding it very difficult, and therefore they were reporting that they were very tired, you know, they were feeling sleepy, and which meant that they cannot really effectively look after the younger ones. Like I mentioned, most of our women, they have at least a child under 5, under 1, and more than 2, more than 3, you know, so they need all the energy they could get. Since the vitamin D intake, they've reported energy level has risen. They feel more, you know, they feel more better within themselves. They feel like, you know, they can go out there and, you know, do things that they love, rather than just staying at home because they just feel like their body is giving up on them. And also with bowel cancer, we've developed a questionnaire where we're trying to find out what's stopping, you know, our community from, you know, uptaking tests to help them, or to capture whether or not there is a possibility of bowel cancer to be investigated. So we want to encourage them. So we've developed like a questionnaire to make sure that, you know, we know how we can better put the service to them. So we've had like a trial where we've asked this session with a group of women. So we're focusing mainly with 56 to 64-year-olds, men and women. So we had like a trial question, and we're trying to encourage that, you know, whoever we speak to about bowel cancer, they could now go on back home and speak to, you know, the father-in-laws, the mother-in-law, and the friends and family. So they're creating more awareness. We had this session where we had 18 people, and only 2 individuals knew or have heard about bowel cancer before. And after the session, everybody wanted to know more, and they were very excited to go home and tell their family members. And that's what we're trying to achieve, that because we believe that knowledge is power and it deliberates. And especially because we're empowering women, when you empower one woman, you actually empower an entire household. So we're targeting those individuals, and when they come to that sessions, they come in with babies and, you know, young ones under 5, so they're getting active as well. They're getting healthy snacks, you know, they're enjoying it in dancing, and it's creating a very good harmonious atmosphere. And also we're encouraging play, you know, due to perhaps, you know, culture. Sometimes some women find it quite difficult to interact with their kids, so we encouraging the benefit of play, you know, and like, for example, with breastfeeding, it's not just, you know, you're feeding your baby, it's also a moment that you capture, that you know, you have like a bond and communication and nurturing, you know, and, you know, it just gives like so much positivity, and it also promotes like, you know, the adrenaline to just make women happy and the baby healthy. So our engagement can be built upon by, so there's lots of resources. We've actually saw bringing, like, you know, the GPs, bringing the show star, bringing the health visitors, bringing the refugee midwife. We realized that there are resources, you know, bringing in people who provide food and food banks. There are information, there are resources, GPs are willing to help. However, the communication somehow seems to be breaking down and not reaching the people who actually need to benefit from those services and provision. So I think that we need to just continue to listen to the people that we serve, and also provide more educational, you know, for example, like you building this information. The challenges that we had is that you providing the women with this information, they have children, and sometimes they can find that they're forgetting the information. They'll come back to the next session and seem to be asking the same type of question. So they will need like an environment where they're free, you know, like, you know, children have like a crash, and women are getting this information free from distractions, you know. And also one thing that came to, you know, that became clear is that we need to engage more men, you know, to support, for example, the women, which I am mostly based on, to support the women. It's like the men need to have the knowledge. They're working, they're providing, they're working low pay jobs, they're becoming tired, and the household burden is just, you know, lying on one individual, which is the mom, and the mom are becoming burnt out, and which is creating depression and all the sickness at the back of it. So we need to kind of like build on how we can engage more of our men in regards, for example, I know there are things going on in regards to cancer with men, but also mental health focus, you know, that would be really good to kind of like make our men with our women know how they can better support themselves. My final word will be that the Core20plus5 project it's literally an answer to a very vast problem, and it's making a very big impact, because we've seen the result instantly. You know, like I mentioned earlier, that we were in a group of 18 people, because we've only just trialed this questionnaire once, and it was 18 people, and only 2 people have heard of this, you know, and the rest haven't. And they, you know, their family members haven't either. They've mentioned, because they said, you know, they contacted the family member, and they said, you know, our family members are also not aware. So we really need to kind of like take this seriously and invest in it with our time, you know, finances, and tackle for the benefit of our children. And also, you know, just invest on education, and also provision for the people that we're trying to target. They're having a clear mind by making sure that, you know, enough support is given within the sessions or within the interaction and engagement. And just thank you. I cannot end this without saying an absolute thanks to our trainers. I would like to say thanks to Peace and June, because they equipped us with enough knowledge and you know, tools in order to go out there, listen to the community, bring back feedback, and be listened to and make a difference. So thank you so much for all the training that's, you know, going in the background and following up. Thank you to Can.